The whole purpose of the 340B program is to expand access to affordable medications to uninsured, underinsured populations. And I actually grew up in an underinsured family. When I was a teenager, my father was diagnosed with multiple sclerosis, and he was the sole source of income for our family. Over time, he just couldn't work anymore. And we had trouble finding physicians and other providers that had the expertise in this disease area. So we actually had to travel some distance to the big city where there was an academic medical center. And this was before there was a 340B program. And this institution is in the program now, and it certainly deserves to be in the program because it's serving a lot of the families like mine that just didn't have the resources for their health care. And the cost of drugs was a huge issue for our family. My father was on 5 or 6 different medications, and in a declining income, we just couldn't afford those medications. But you know, if there had been a 340B program back then, it would have really helped our family. And so for me, access to affordable medications is a very personal issue for me, and one that I'm passionate about. The 340B program was designed by Congress to provide assistance to what we call safety net providers. These are either public institutions or private nonprofits that have a mission or a legal commitment to take care of uninsured, underinsured populations, people who just can't afford their health care. These institutions tend to be very dependent on taxpayer support. So Congress thought that by lowering the cost of the drugs for these institutions, they could stretch their scarce resources to serve more patients and provide more services. If the 340B program was eliminated or scaled back, there would be direct repercussions for patients, that they would have to close their oncology center, that they would have to close their outpatient pharmacies, they'd have to let go of nursing staff or physicians. Ultimately, patients would receive fewer services or more expensive services. And pharmacy services in particular, I think, are most vulnerable if this program were eliminated. Often, access to medications is a life or death issue. So for many of the patients served by our members, the 340B program is what's keeping them alive.